Hi, welcome to Conexión 360 Insights. I'm your host, Fernanda Duran from the National Hispanic Health Research Institute, or NHERI. This podcast is all about exploring the intersection of community-powered research, funding, policy, and innovation, bringing you conversations with leaders who are shaping the future of health equity. If you like this content, make sure to subscribe on our YouTube page or LinkedIn to stay updated. Today, I'm excited to welcome Dr. Amilcar Guzman. Amilcar is a program officer at the J.B. and M.K. Pritzker Family Foundation, where he supports national and state partners implementing effective prenatal to 3 systems that improve the lives of those furthest from opportunity. Before joining the Pritzker Family Foundation, he worked in various education policy and research roles in the Washington, D.C. area, giving him a unique lens on how research, policy, and community impact intersect. I talked to Amilcar earlier today. He and I worked together in Washington, D.C. in the past. Here's our conversation. Thank you so much for joining us today.
Thank you so much for having me, and I'm looking forward to the conversation. Thank you.
Yeah, me too. Amilcar and I, like I said, we've worked together in the past. Now, I know that you've always put community first. Tell us a bit about your journey and your current position, how that is part of your story.
Thank you. Yeah, so I'm a first generation student, first generation young professional, the child of immigrants. So, my story has always impacted the issues that I work on and how I pursue different passions. Whether it was working with immigrants, whether it was being on Capitol Hill and thinking about how do we develop policies that better support families, whether it was in graduate school and as an adjunct professor, thinking about how do we help support the next generation of young professionals, or in my role now where I'm in philanthropy, trying to think about how do we fix systems? How do we work to improve systems, right? How can we partner? How can we partner with different groups? How can we make sure that systems support families? And so in my role now, I'm fortunate enough to be able to do that and to use resources to help make some of that change happen.
That's fantastic. So let me start sort of at the big picture. As we know, the healthcare landscape is shifting rapidly, but sometimes, and you tell me if this is true or not, it feels like community-based organizations are still operating in old playbooks. So my first question is, what are the biggest changes you've seen in your tenure, and what are the major shifts in U.S. healthcare or research that you see? And most importantly, do you think community-based organizations are aware of these changes, or they're underestimating their impact?
Thank, thank you so much for that question. So a couple of things. I think and I'll speak from the perspective of philanthropy, right? So when we are trying to work with different groups, trying to support different groups, we're always thinking about what is the impact that you're making? What is the change that you're having? So for community-based organizations, that's part of the shift. Like, what is the impact? What is the longer term change that they are making through their work, right? So that I think is something that is often not at the top of mind. What are the population level indicators that they're trying to move, that they're working towards, right? All of their work is in service of creating change and making people feel healthier, happier, and whole. Right? So that to me, I think is something that is often not at the forefront, and is something that's quite honestly missed, right? For lots of groups. Certainly, I think within the health sector, but across the board as well.
So let me just push back on this, or get clarification. So you're saying that a lot of times community-based organizations aren't putting enough of their resources into showing on paper what their organization is all about in terms of numbers, in terms of perhaps research that indicate the benefit of the outreach or the programs that they have.
Yeah. So yes, and it's not just numbers, right? It's the whole picture, right? We know quantitative data, qualitative data. So it is a whole, right? Because you need the data, you need the numbers, but you also need that qualitative data to be able to help tell that particular story. And I think less of putting resources and more of like thinking more longitudinally, right? So how is the work that we're doing today going to change the lives of families in 3 to 5 years, right? That longer term vision focuses more on what are what are those outcomes, right? So less about resources, more of a mind. How how is the thinking there different within leadership, within staff, so that they can understand what is the longer term impact of the work that we're doing today.
Great. So let me ask you the next question. How do health providers and other organizations position themselves to actually demonstrate that impact that you're talking about?
So that I think is a great question. I in my conversations, we talk a lot about partnership, right? So if you're a community-based group, how are you partnering with those folks who can provide that expertise, right? If it's not in-house, right? Or are hunter within the community space. So we often will see lots of groups working with universities or other research entities that are centered in community. That I think is critical, right? You don't want a huge research firm that doesn't understand the work that you're doing or doesn't understand the community that you're serving. It's so how you're engaging with local folks who might bring that expertise to help you design what that work might what that work might look like, and what are the indicators that you're trying to kind of look at and focus on. So many groups we often kind of will work with and kind of put that out there for them to kind of think about, right? Like, how are you engaging in some of those efforts?
That's great. So now we talked about positioning, right? Funding is another that's a big question for organizations, and that's what they talk to us about all the time. I know you have obviously a unique perspective in your work with the Pritzker Foundation. Where do you see the greatest opportunities, or perhaps the risks in the intersection of community health research and these emerging changes? How do you see organizations being positioned in terms of the funding?
Yeah, it's such a difficult time right now. You think about um, federal funds and the passage of federal legislation has created some of these cuts, and also federal actions that have created cuts to lots of groups that we work with that are heavily reliant on federal funding. You're also seeing in the future state funding, right, will also fluctuate as well, given federal actions, but also what's happening in states too. So philanthropy, helps to fill some of that vacuum, but it's never going to fill the complete vacuum of like large federal grants or state grants as well. So what we've often talked about with our partners is how are they engaging locally with key folks who might want to step up, volunteer, donate, right? That's I think a source that has come up often in our discussions. And as funders, we're also talking to other funders to help talk up the work of our crew. That's on us, right? That's the role of philanthropy, right? To be a connector and to help support groups that need the support. So I would say for a community-based group, uh, just to ask your funders to connect you with other folks, right? Like that is the role that funders should play and continue to play going forward.
So the follow up to that is what are funders prioritizing at this moment, so that organizations can position themselves to get the benefit of that, and what do communities actually need to do to implement those priorities effectively?
Yeah, that's such a good question. I think it is a difficult time right now. I think we're facing a difficult time as a country. And I think every sector is reacting in different ways. You think of higher ed, you think about like state governments, local government, philanthropy, I think is no different in terms of the responses. You look at the movement that we've seen in the last year focused on diversity, equity, and inclusion has created a situation in which, I think lots of folks within philanthropy are cautious in terms of their giving, right? So that I think is a challenge for philanthropy and also I think certainly for community-based groups. Now, I mentioned earlier about impact and outcomes. That is something that I think across philanthropy is at the top of mind, right? I mentioned quantitative data, but also qualitative as well. But how are you demonstrating the change, right? What does that look like? How is that change different than what you've done in the past? And how are you continuing to move some of that work forward? So that I think it is the priorities. Less on issues right now, more on like if we're gonna invest in this particular group or this kind of work. At least the question that I think about is how are we getting to our goals? What are those outcomes? And how is this work tied to that in particular? So that's why I kind of made the comment like if you're a community based group, thinking longitudinal to the work that you're doing now and how is that moving towards impact.
Right. Just kind of going off on that a little bit, because it's really about communicating the impact, right?
Yes.
Getting the funders to understand what your story is, getting to that authenticity, staying true to who you are, even though you were talking about that DEI aspect, but staying true to who you are and telling those stories doesn't have anything to do with DEI. It has really to do with your authenticity of why you're there, of who you're serving, right?
100%. I think if your mission is core to serving a particular group of people from a particular background, you don't want to change that. That would go against your values, your principles, right? But I think it's important to understand now, as a country, some folks might be just more cautious, right? And that's part of the conversation, right? That I think we all have to ask ourselves in terms of the work that we do, the programs that we support, and the impact that we want to have.
So how do you strike that balance? What's the right
Mm.
mix between, telling your story or you're being authentic or not? I think that's sometimes a hard place to land.
Yeah, no, I think that's a great question. And so, we work with different levels of community-based groups, right? Groups that are bigger, more organized, have a relationship at the state level. You think of CASA, right? As one. And there's also groups who are like small, like 3 people, 4 people, who they may not have the ability to be out there like that because of one grant that they lose might go away. A larger group might have the opportunity because they have a more diversified funding. They might have like that flexibility, or it could be vice versa. A smaller group, right, who is not as out there, is not um in terms of these issues, might feel like they have a little more flexibility to do that. While a larger group, because of pre-existing relationships, might find it more difficult to be out there on certain topics. Now, if you're working in a coalition and there's multiple kinds of different groups, that's where you kind of engage and think about who is stepping up and who is stepping back on topics and different issues. Um, well, that's why I think working collectively, you get a sense of which is the best group to lead in a particular way and which one it's better to step out.
Yeah, so I mean that's kind of the reason we created this organization was really to pull organizations in to bring conversations to also provide resources because what we may know this conversation we may get but other people may not have the time or ability to create these resources. So that's why it's so important to share the knowledge, right? My next question would be, just kind of going back to the research part of it and to putting in paper what the benefits of the organization are, what the impact. Is it something that is impossible for those small 3-person organizations to do, or do you think that because I've seen those organizations like one person trying to do everything, but if you were to say in terms of priority, how important is that?
So I'll start with with the end. Absolutely. No matter if you're one person organization or 100, it is essential because that is how you demonstrate the work that you're doing and the impact that you're having. That to me, if I was starting an organization tomorrow, I would do it coupled. What what are my programs and services? At the same time, how am I demonstrating the impact of those programs? How am I going to tell this story? I think it's in tandem. Is it harder if you're a small organization? Yes. I mean, there's just no way. There's less people, right? There's less staff to help do that. But I that doesn't take away from the opportunity to be creative. I mentioned kind of thinking about partnerships. How might you leverage that expertise from academia in particular, right? Is one that comes to mind as a good one. And how, again, do you work in coalition with maybe larger community-based groups who have that expertise in-house? So I think that is something is so critical that should even though there's a lack of staffing, smaller, there is a way around it. There is a way to kind of get there and help create that change because it will only lead to increased resources, right? Like that's the point, right? To tell the story, but also to be able to get additional resources, right? So it's like a cycle because if you don't have the impact, then you can't tell the story, and if you don't have the resources, you can't tell the story, right? So it's like, how do you tell the story in a way that's creative until you're able to build up and have those resources that you can bring in staff to do just that.
Okay, so that's super helpful. But if you're just sitting down with Neri and its partners, what would be your top two or three strategic priorities for the next 3 years that you would give us in order to be successful in achieving funding?
Yeah, I think when we look at the landscape right now and we see that there is severe cuts to things like Medicaid, to things like food assistance, that is going to be an area I think for all groups to think about across the board, right? When we're talking about health, how are people accessing health? So and there's so many different models out there that exist, right? Community-based models, regional models. There's effort in rural areas, but the access piece is a key component, right? Um, that to me is going to be top of mind and it cuts across all sorts of work. Additionally, I think food assistance is another area and another priority when we look at again federal changes, but also the affordability of food and the economy is through the roof. So you're gonna have families in that area working, and we know that how food security is tied to health, right? It's all connected. Um, so that's kind of the second big area that comes to mind.
So you think that the big sort of impact hasn't hit us yet? That
No,
there's a lot more to come.
yeah, no, I think we haven't even seen the real changes happen, right? This major legislation passed in July, and February 1st, we're supposed to start to see changes around Medicaid, but also food assistance. So I think it's going to be another 6 to 8 months before we start to see the real impact hitting families.
And also the cuts in healthcare or like health insurance, those are gonna way down the line because just because you don't get health insurance today doesn't mean that you're gonna be sick today. You're gonna be sick a year from now, 2 years from now, or even 3 years or later on, right?
Yeah. Right. So yeah, so we've seen the policy changes, but we haven't seen the impact yet. Um, that's why I said health and food assistance. Like those are the key areas that I think will play a critical role.
So now going back to what organizations should be doing, what should they be doing right now to kind of get ready for this? I guess it's a little bit of a wrap up of the whole conversation we've been having. What is the number one thing that as an organization they should be thinking about?
Yeah, I think it's like how are you supporting families around these two areas in particular. If you have existing programs related to healthcare or health, excuse me, health access or or outreach, how are you prioritizing that within your community, like within your non-profit or community-based group? Staffing, funding, research, right, because you're gonna want to demonstrate the work that you're doing during these next couple of years, right? So how are you getting yourself ready, right, for what's to come? Also within the food security space. If you don't have programs in those areas, how are you partnering with groups that do? So if you don't have a food assistance program, is there a food bank in your area that you can start to partner with? Because you know that families will need these supports, right? So that's kind of the second thing. If you have it within these areas, make sure that it's strong, make sure that it's staffed, funded, and you're able to demonstrate the impact. If you don't, what partners exist that you can turn to and engage with, and you can build this larger coalition?
Sort of the infrastructure that you're going to need, sort of like the building that you're going to need in order to withstand the hurricane, kind of thing.
Right, right. Because if I'm a group that does legal assistance, um, but families aren't coming to appointments because they can't eat, you still want to be able to help them, right? Like, so if you don't have if you don't have those relationships built now, it's going to be hard. Right, so that I think is the key. So building the relationships across the ecosystem so that families that you see can also get supports in other places.
Well, I don't want to say that this was a great conversation because it's actually really, really sad. And I think that we need to be having more of these conversations, getting ready for what's to come. And I hope that we can all come together and be able to help our communities because that's really what's most important here.
I think 100%, yep. And yeah, I wish that we were not here as a country, right? Um, what what gives me hope is the people, right, that I work with, that the folks who are passionate, right, who share my background, first gen child of immigrants, who are doing the work, right, who are wanting to help families, right? And how can I support them, right, in making that happen? So I think we all have a role to play, whether you're doing the work or supporting the work, and it's just finding what that particular role is.
Well, Milka, thank you so much. This has been a very rich conversation. I think you've given us a lot to think about, not just in terms of challenges, but real actionable strategies for organizations that want to do this work more effectively. So thank you so much for sharing your insights.
Thank you for taking the time, and thank you for the great discussion.